Hi everyone, welcome back to my YouTube channel, and today we are going to talk about temporalis muscle. So let's start our topic with introduction. Temporalis muscle is a broad fan-shaped muscle that is located on the side of skull, as you can see in diagram. It is one of the main muscles of mastication that are responsible for elevating and retracting the mandible. It is powerful closer of the jaw and play a major role in chewing. Origin of temporalis muscle. It originates from the floor of temporal fossa that is formed by frontal bone, part of frontal bone, parietal bone, temporal and sphenoid bones. It also originates from temporal fascia that is from the deep surface of temporal fascia. Temporalis muscle insertion. It is inserted into coronoid process of mandible and anterior border of mandibular ramus. Nerve supply of temporalis muscle. It is supplied by deep temporal nerves that are branches of mandibular nerve, that is branch of trigeminal nerve, and that is fifth cranial nerve. Blood supply of temporalis muscle. It is supplied by deep temporal arteries that are branches of maxillary artery, and also by middle temporal artery that are branches of superficial temporal artery. Structure and parts of temporalis muscle. The muscle has two main fiber orientation. First is anterior vertebral fibers that are for strong elevation of the mandible, and the second is posterior horizontal fiber that is for the retraction of the mandible. Actions of temporalis muscles. First is elevation of mandible, as temporalis muscle close the mouth powerfully. Second action is retraction of the mandible, as posterior fibers pull the mandible backward after protrusion. Third action is grinding movement, as temporalis muscle help in positioning the jaw during chewing. Relations of temporalis muscles. First, superficially temporalis muscle is covered by skin, subcutaneous tissue and temporal fascia. Deep to temporalis muscle lies in close contact with temporal fossa and skull bones. Temporal fascia attach to superior part of zygomatic arch and provide protection to temporalis muscle. Functional importance of temporalis muscle. It is one of the strongest muscles of mastication. It works with other masticatory muscle to allow complex chewing movements. It maintains resting mandibular posture and stabilizes the jaw. Clinical relevance of temporalis muscle. First is TMJ disorders, as overactivity or imbalance of temporalis muscle can cause temporomandibular joint pain or headaches. Second is bruxism, that is also called as teeth grinding. It leads to hypertrophy and tenderness of temporalis muscle. Third is temporal arteritis, that is superficial temporal artery near this muscle can be palpated for diagnosis of giant cell arteritis. Fourth relevance is dental procedures, as knowledge of its attachment helps in surgical approaches to mandible and temporomandibular joint. Conclusion of this lecture video. Temporalis muscle is broad fan-shaped muscle that elevate and retract the mandible, thus contributing significantly to mastication. It is supplied by mandibular division of trigeminal nerve, and it is crucial for jaw strength, chewing efficiency and dental health. And this was all about temporalis muscle. Hopefully you liked the video. If you do, don't forget to like, share, subscribe and comment. Thank you for watching.